Another common disease that is transmitted by food water is hepatitis A, typhoid, so a couple of those that are food waterborne. These two are important because they are vaccine preventable. Traveler's diarrhea in the United States is not vaccine preventable, but hepatitis A and typhoid are. And in fact, for hepatitis A as a virus, it's one of the most ubiquitous viruses in the developing world. So much so that we just assume it's in the food and water supply, meaning that all travelers going to developing countries should be vaccinated against hepatitis A. Simple vaccine. In fact, if you're less than 40 and over 1 year of age and don't have any liver problems, you can take the hepatitis A vaccine 1 day before you leave. It still works. But the CDC does recommend if you're leaving within 2 weeks and you're over 40, less than 1, or have some disease state that would make giving a liver infection, pretty drastic or dramatic for you, then we recommend that you also add on the immune globulin. Right? So you might get what's called IgIM plus the hepatitis A vaccine before you go out. For typhoid, typhoid is actually a little harder to get than hepatitis A. There are two main things that predict your risk for typhoid. The first is if you like to eat in a rural area. So let's say you're going to Thailand, Bangkok versus some remote areas in Chiang Mai or Chiang Rai. Those have a very different profile. So if you're eating in a urban area versus a rural, you might be at less risk. But you can modify your risk. So if you're really looking for typhoid, the way that you can modify it is how you eat. So I always ask my patients, are you an adventurous eater? If they giggle, I know they are. Right? What that means is they're going to eat from street vendors, hole-in-the-wall restaurants. What other people are not going to eat, they're going to eat. Those people are at much greater risk for typhoid, and they should be vaccinated. We have two options for typhoid vaccination. You can use an injection. The injection lasts for about 2 years. It's about 60 to 70% protective. You can take oral. So oral typhoid vaccine, which is called Vivativ, comes in a little box with 4 capsules that are taken 1 every other day. Takes about a week to complete. It's also about the same effectiveness, but it lasts for 5 years. So you have two options that a patient has to choose from. If they don't want a shot and want to take capsules, they can do that. If they want to get it over with in 1 dose, they can do the shot. Either are equally effective.